Okay. I hope all you can hear me.
Yeah, we can hear you.
Thank you. Okay. Welcome to the second edition of research methodology webinar series, module 4, organized by the Association of Resident Doctors, Institute Teaching Hospital, Parkland. You are all welcome. And today we have in our presence Dr. Onyekpa Ifeanyi Johnson. And sorry for the time we've wasted so far. It's just some technical issues that we have. Chief, you are welcome, sir. Without wasting much time, I'll just do a few introduction. I believe most of us know him. He's our chief, especially in Ops and Gain, Department of Gain in ASU Parkland. He's a consultant of social and gynecology and a senior lecturer. And he has authored and published 55 scientific articles in various international peer-reviewed journals. And he has also supervised a lot of candidates in Part 2 Fellowship of West Africa, and also supervised fellows too in National Postgraduate Medical College of Nigeria. He's also my supervisor, and I believe that we're going to enjoy this outing. Chief, you are welcome, sir. Chief, you have the floor, sir. Thank you.
All right. Thank you, everybody. It's a privilege and a thing of honor to be here. I don't want to waste our time. It's not that I know much or that there's anything special about what I am about to say now. I just believe that, as it is said, iron sharpened iron. That by the time we finish, we'll be able to learn one thing or the other to help us run this program and run it successfully. As I said, as we know, in residency, there is no time when somebody will come and begin to write on the board and teach you. So many of the things here is you learn on the job. So part of it is that we all learned on the job, and because we learned on the job, you can never achieve perfection. But as we move, we will eventually get close to perfection. The aim is to prepare us so that at the end of the day, we will not get dumped in residency program. We will see the program as and when due. So once again, I want to thank all of you for this opportunity. So today, we are looking at dissertation writing. It's an overview. Nobody can in one swoop explain to us or teach us how to write a dissertation. It's not possible. Most of the things you get is a guide. And then as you go on with the exercise, you will eventually learn better. We learned that way too. So without wasting that, this lecture or this is not a lecture, this interaction is supposed to last like how many minutes do I have?
You have 1 hour 30 minutes, sir.
Okay, so I will try my best. And I want to also crave your indulgence. I am not how do I put it? I've not been trained to proficiency in research, so that nobody will say, is this what this guy has to offer? Just pay attention, you get something. So move. So we're going to look at the structure of any dissertation. And in that place, we'll be looking at introduction to literature review, methods and results, discussions, conclusion, referencing, and plagiarism. These are the things that we are supposed to look at. So without wasting our time, let's move. What is dissertation? Because before you start thinking of how to write, you will have to understand what is dissertation. Now, when we were in medical school, we did what we call projects for our MBBS, which is for BSc. So when you want to do your master's and PhD or fellowship, you now you rise to what we call um, thesis or dissertation, depending on the nomenclature they use. So for us here, dissertation is what we do. And dissertation is basically for the award of a doctorate, if it's a university program, or for the award of fellowship, like what we are doing here from the colleges. So a thesis or dissertation is a major work of scientific inquiry submitted by a scholar to a university or an equivalent academic or professional body for the purposes of obtaining certification that the scholar has acquired specialized knowledge in a specific discipline. So dissertation is not like our projects in the medical school. Here, it's expected of us to venture into the field where we are and increase the body of knowledge. So we must be able to add something to the body of knowledge after the dissertation is submitted. If we can't achieve this thing, that means what we have just done is an exercise in futility. So from the onset, you must identify a problem that you want to solve. And at the end of your dissertation, somebody will say, this thing was there before, but this work has resolved it. In a university, this can be far, it can be for the purpose of obtaining a doctorate. But here, we are talking about obtaining a fellowship or a membership, depending on where you are. It can be regarded as the more detailed version of a full-length manuscript, incorporating a much more extensive body of work. So if you want to publish an article, it's a summary, sort of. In dissertation, you are full details are required, how you arrive at the point where you are. So dissertation is a lot bigger than just a manuscript. A dissertation is a structured writing with specific pattern and order. Every institution has its own pattern. And so when you are writing a dissertation for a particular institution, you must find out what their order, what their pattern is, so that you don't say, because I have written a dissertation in University of Nigeria and Suka, I will just superimpose that pattern to write your dissertation in West African College of Medicine, physicians or surgeons. So you must make sure you know what is the pattern that the institution you are writing for endorses. This may vary from one institution to another. A scholar should acquaint himself with the expectations of the institution he is submitting the dissertation to. Here, the colleges of physicians and surgeons may have a lot of similarities, but subtle differences still do exist. So I'm a graduate of the College of Surgeons. I've not been to the College of Physicians, but I know that the differences may not be much. What we are giving here is just a guide. You have to go to your own college and find out the subtle differences so that you have a seamless flow. The main component of a thesis or dissertations are you have the cover page, which is almost the same thing as the title page. But the difference is that in title page, there are little more details, especially about the author, his names, and other things. So we have the cover page, title page, certification page, acknowledgement page, dedication, table of content, list of abbreviations, and you get those things in the document. But when we look at the abstract, let's start from there. Abstract is more or less a summary of what you have done, so that somebody who doesn't have the privilege of reading the entire book, when he reads your abstract, he will be able to understand what you have done and what results you have gotten. And the such abstract should be structured, or in some cases they may be non-structured, but the structured abstract is the preferable method these days. Then you now have the body of the dissertation or the body of the thesis. And in this body, you have introduction, you have the literature review, you have statement of objectives and your working hypothesis, you have materials and method. Then you come to results, discussions, conclusions, and recommendations. These are the things that will make up the body of the dissertation. Let's look at the title. The most important work any researcher or any resident the most challenging, I think, to me, is to be able to select a topic, a title that will be researchable and will be accepted by your institution. So if you don't have a good title, of course, that's the beginning of the failure. Once you send your proposal or your dissertation, what they are looking at first, what is this working on? So most time the question they will ask you is, what are you working on? What can we know what you are doing? So you must be able to select a title or a topic that is researchable, a title that is relevant to the current situation or the uh, uh, current period, not just anything. A title that was acceptable, let's say in 1980 or even 1990 or 2000 may not be relevant today. Even a title that was relevant in 2010 may not be relevant today. So you must look at the need of the society in the area you are studying and then see a problem, identify a problem, and then by your title, set to solve it. Selecting or choosing a title is about the most important exercise in dissertation writing. A title must be clear and unambiguous. So if you have a title that after reading, even the reader does not know where you are going to, what you intend to do, then it's not a good title. Your title must be unambiguous, must be researchable, and must carry all the information to guide an intending reader. A dissertation must be able to add something to the existing body of knowledge in that field. And it must include what to study. That's the title. What you want to study will be obvious. It must include where you are doing the study. Is it a hospital-based study? Is it a community-based study? Is it depending? It must be obvious from your title. And the location or the area or the region where the study is to be done must be seen in that title. Is it in Nigeria? Is it in Enugu? Is it in USA? So you must be able to catch those things in your title. And then you may or may not add the type of study it is. But if you add the type of study, for instance, if I say I'm comparison of the height of females and the height of males in Esuch Teaching Hospital, a randomized control trial, something like that. So in that way, you have now described the type of study, you have described where the study is to be done, you have described the region where it is done, and you have described the area that study should be done. So that when somebody opens your article and looks at the title, he can say, this is a Nigerian study, this is a study in Enugu, a hospital-based study, is a community-based study. So those things should be obvious to the intending reader. Otherwise, you may not catch the attention you wanted. Now, take for instance, a comparison of oral misoprostol with intravenous oxytocin in preventing primary postpartum hemorrhage in a tertiary center in Enugu, southeastern Nigeria, a randomized control trial. This is the title of a study somebody did. So in here, you look at it. When you look at it, you say, comparison of oral misoprostol with intravenous oxytocin in preventing primary postpartum hemorrhage. This is what you want to study. It's obvious in the title. Then where is this thing? Place of study. It's a hospital-based study. It's obvious from the title. The area of the study, southeastern Nigeria or Enugu, southeastern Nigeria, is also obvious from the study. Now, it's a randomized control trial. The type of study you're doing is also obvious. So if somebody is looking for randomized control trials, he will see this one and pick it. But if the person is looking for a cross-sectional study, he will look at your title and will not bother going to look at it because it doesn't enter. Then some institutions may have a limit to the number of words, including the spaces in a title. So you also have to find out what is the word limit for the institution you are submitting the dissertation for examination, so that you don't exceed that word limit. Some examiners are very strict that when they find out, they will return your book. And maybe the advice will be rephrase your title or change your title in line with our guideline. Now, that's for the title. Then you go to the preliminary pages. Are those parts of this dissertation that are not actually the work per se? That's where we have cover page, all the dedication page, and the rest of them. The cover page will include the title of the thesis or the dissertation, the name of the author, and the institution to which the thesis is being submitted, and also the year of the submission. So if you come at the title, maybe at the end of the day, you now say October 2025. That may be when you are submitting it. Then the title page is usually a replication of the cover page. The only difference between the title page and the cover page is that the cover page does not have the name of the author. That's the major thing. But in the cover title page, you have the name of the author. Then you have the certification page. This is a statement that is affirming that this work is an original work done by me or done by whoever is submitting. You are, it's like an oath taking that this work is original. You are authoring the work, and you are, this work is not a copycat. You have not published this work, and no other person have published the work. It is original. It is certification page. Then you are, the acknowledgement page is where you are now acknowledging all the people, you are expressing gratitude to the people who have helped you achieve this work. They are not, they are minor, but they are, it's just, they are courtesy that you must abide by. Then you have the dedication page where you are dedicating the work to whoever, somebody, some people that have affected your life positively in the past. Most people say, I dedicate this work to God, to my wife, to my children, to my father, and the rest of them. Like if somebody has taken the stress of training you through medical school and the rest of them, it's expected that in this page you may recognize him. It's not, I don't think anybody is going to award you so much, award so much relevance to these preliminary pages. Now, you come to the abstract. The abstract is what is important for indexing if you want to publish this paper. It's a summary of what you have done so that an intending reader will glance through it in less than 1 or 2 minutes, and you know what you did, how you did it, and the results you got. Now, if you want the full detail, you can now go into the body of the dissertation. Abstract is often targeted at about 500 words in length. I think that's what West African College of Surgeons have too. I don't know about physicians, but it should not be verbose. It should not, there should not be too many, it should not be too long, because it is not the work itself. If it becomes too long, the intending reader may be discouraged. In abstract, there are no references. When I was doing my dissertation, the first proposal I wrote to my supervisor, I had references on my abstract. And what the professor told me, well, number one, you don't put references here. It stuck to me. I learned it, and it has remained there. So you don't put references. It may be a temptation you may make. When you do it, it means that you have not really learned your rope. No references. And many awarding bodies now demand a structured abstract, details of which are usually provided by the institution. Now, the structure looks like this. If it's a structured abstract, what you are going to get in that abstract will be a background, which is an overview of the subject matter, what you're doing. Then the M, what you intend to achieve from the study. Materials and method, where and how and what you will use to achieve um, um, that particular aim that you have set out. Then your results, you now have a conclusion. That's a summary of the abstract in a structured format. Background, aim, materials and method, or some say methodology, results, and conclusion. Now, whoever goes through this one will be able to summarize what you have done and the outcome. Note, after the abstract, footnotes are given a maximum of 5 words or phrases that guide in indexing and searching for the work if you are publishing it. Some colleges or some institutions will even want you to put footnotes in your dissertation, but this one is usually seen when you are now publishing your work. It's for the purposes of indexing and tracing and searching. Then when we go to the body of the dissertation itself, the first thing there is introduction. Introduction is an overview of the subject of this you are studying. Here, you want to bring out what is known about this subject, where we are, the problems that may still be there, that will make the intending reader, after reading your introduction, he will say, this study is worth carrying out. It is like a bait. You are giving the reader a bait that he will test and he will desire for more. So by the time you finish going through writing up your introduction, whoever is your intending reader or examiner will say, this man has a reason. There is a justification. There is a rationale for this work. Let me go in and find what he has cooked. It stimulates the appetite of the reader for the work. If your introduction is poor, the reader may stop there. Of course, for the purpose of examination, of course, it is going to score very low mark. So you have to stimulate the appetite of the examiner or the reader. I use the word in reader here because as a scholar who is already at the level of writing dissertation, it's not just for the exam. You have the the whole world as your audience, and you have the whole scientific or academic world as your audience to stimulate them to announce your arrival that I have joined the league. So this introduction must be catchy, must not be too verbose. You also get a word count. Know what the word counts for your college, and make sure at the end of the day, whoever is reading is stimulated to read more. It will be able to convince the reader that the work is worthwhile and encourage him to look at the entire work. In other words, it should generate a rationale or justification for the work. Then, after the introduction, you now go to literatures. You are going to start different published articles, textbooks, known knowledge about the subject matter. And this is a very extensive work. In short, most times, this is where people get tired of the work. We feel like jumping from possibly from the introduction, go to the method, and then do something. But if you cannot build on what you cannot build on nothing. Every aspect of life has already been studied to a large extent. So you have to know what has been known. From the known, you now go to the unknown. It's after the literature review that you will be able to find knowledge gaps, deficiencies in knowledge, problems that are yet to be solved, questions that have no answers yet, that you are now going to answer or you are going to proffer solution for. So it's an extensive search. Before now, when we don't have internet at our disposal, literature search was a very difficult thing to do. You may have to travel from here to Lagos, to Jos, to Sokoto, just to get manual, handwritten, or what I mean manual, that is typewritten articles, because there's no internet. I wonder how they succeeded then. They must be very serious people. But yeah, the era of internet has brought the world to our rooms. So in your room, you can do all your search. You can go to US, UK, India, anywhere, just from the comfort of your room, and you have all the knowledge you have. So literature search at this age should not be something that will be so cumbersome. However, scholars or students still find it difficult to do. It includes, but not limited to, previous publications on the subject. So when you are writing a literature review, you are not only writing about the previous published articles on that area, you are also writing about every knowledge known, whether from the textbook, from journals, from magazines, from anything, wherever you know that the article is reliable, you can pick from there, depending on what you're writing about. You can use different search engines or databases to search. For us in medical fields, most of the common ones are PubMed, Google Scholar, Scopus, Science Direct, etc. Depending on the one you have access to, on the one you choose. But make sure you use these ones to start. And it will appear in your literature review. You must tell the examiner which search engines you are using, so that if you want, you can also go there. Please don't make mistake of quoting a search engine you never use. Because if they go there and discover that, you know what they mean? Continue. Okay. If they go there and discover that you never use them, I think just a moment. Can you? Okay. You can be sharing. Okay. You can be moving it. So move it to where you answer. Literature. I thought you were. Yes, I was moving it, but somehow we are not moving at the same time. You were not moving at the same time. So you are the one that shared before I shared for you. Okay. So you have to align this up. All right. So please don't. Okay. Don't make the mistake of quoting. What I've seen in the recent proposals that I'm looking at is that people will just say you quote up to 10 search engines when he didn't even use one. So at the end of the day, when the examiner or your assessor try to search, he will not see what those things you use. So please, it's a big lie you may tell. Some people may ignore it and you pass, but if they discover your paper or your proposal or dissertation may come back. So please use these search engines, but don't quote the ones you are not using. Access to online libraries such as Hinari will be of immense help. Some of these documents, some of these publications are not free. They're not. You may have to pay money, but if you have this free online libraries like Hilary is the common one here. You can access those documents without necessarily having to pay. And you can also crack. It's not advised that you crack into those libraries, but those things come up when you have people from poor countries, not poor countries that are struggling. So, but these are the things that will help you have a good literature search. Now, references are supposed to be recent in a literature search. You don't, except there is no, maybe in a field you have paucity of work. You can, it is advised that your references should be within 10 years. However, there are some findings that are eternal. It may be done in 17th century to 19 something, but those findings are still valid. It doesn't mean that if they are relevant here, you will not bring them. But 80% of your references should be seen within the last 10 years. That shows that you are current. Otherwise, you'll be searching and researching for what others have solved long time ago. So, and when they will be assessing your paper, they will go to your references and check what is the how recent are your references. If they are old things, it may not sell. This is not the same as discussion. One mistake people do in literature review is that they will start comparing the findings of one finding with another finding. At this point, no, you are only bringing out what other people have done, and in that place, you must make sure that the name of the author or authors are there in your literature review. The year this work was done or published, it must be there. The type of study it is, the population studied, the sample size, the result, and the conclusion must appear. You don't just say in 2024, it was found that men are taller than women. That's not a proper way of presenting it. But you can say Mr. X in Enugu in 2004 found out that male are taller than female in a cross-sectional study involving 200 male, 200 female, and that way you are bringing the meat of the study, so that when you want to discuss, it's easier for you to pick that finding. You already have the detail of what happened and how it happened, and you now compare it to what you're doing. So don't just quote something, put a reference on it, and go away. In literature search, you must put these things there: name of authors, where the study was done, name of author, where the study was done, the year, the publication of the study, or the year of publication, the type of study, the population you studied and the size, the result you had, and the conclusion by the authors. That way, you have summarized that study. It's just like a kind of summary of the study you are talking about. This will help during discussion, and don't compare at this stage. It's a temptation, it's something that people usually fall to start comparing. No, comparison is at the level of discussion. Now, at the end of the review, once you have a summary of literature review, what's summary of literature review? At the end of that literature, you are summarizing the findings in the literature. That's the known knowledge. How far, where are we at this stage? When you have it, that will now open up the knowledge gap, open up the deficiency so far. If you finish your literature search and there's no summary, it is like you finish cooking without any salt. No matter the amount of kind of spices and the rest of them that you put inside that food, the test will not come out. So you summarize your literature for the reader or for the examiner. And then that summary should be able to throw up gaps in knowledge, throw up deficiencies in knowledge where you want to fill up. The knowledge gap or gaps that you are studying wants to fill should be obvious at the end of that exercise. Tables and figures should not be included in literature. There's nothing like you are doing a literature, you now bring a table in the result of that study and place it there. It's not acceptable, and it is not done. So the essence of this literature search is to identify what the people before you have done, identify questions they could not answer, problems that are still persisting despite their work, and where you think in your own study, if you do it well, do it different, you must answer those questions. And those things must be obvious at the end of the literature search, and you highlight them. at literature, at the summary of literature review. Then another chapter, that's usually chapter 3, is the aim and objectives, depending. I am using the format of the College of Surgeons, West African College of Surgeons. Well, that's where I belong. Everybody has to promote his own. I'm not a physician, and the physicians should not also be angry with me. We are the same. All right. You look at the aim and objectives. Here, anybody who stands up to go to anywhere must have a direction. If not, you're a madman. So you must have an intention, what you want to do. You don't, because in the instance, dissertation costs a lot of money. You don't waste your resources and time and the resources of the state if you have a resources of your sponsor, if it's if it is sponsored work, just to go to nowhere. So you have to address what is the aim. Aim is the overall purpose, intention, or expectation for which the study is undertaken. Most time, the aim is like a mirror image of the topic. That's why we say that the topic must be researchable, must be explicit. So when you pick your aim, it must look like the topic, that somebody who looks at that topic can tell where you are going. So aim is a general, it's an overall purpose where you want to be. And then you come to objective. Objective is now the different steps, the different things you are going to do to achieve that aim. These are specific findings. I must find A, find B, find C, so that at the end of A, B, C findings, I'll be able to say that this M has been achieved. So it will help you determine whether the M was achieved or not.
And she's
For
even
you to
smart.
get a good objectives, or a good objective or objectives, you must put these things into consideration. It must be specific. What you want to, if it is a height that you want to measure.
She changed to your school. That education.
Somebody, can we mute? Can we mute ourselves?
She's
Who is
even in school.
talking?
Started before her.
Please mute yourself.
Dr. Oluchi, please kindly mute yourself.
All right. So to the one, there's this acronym for selecting good objective. We call it SMART. That objective must be specific. It must not be ambiguous. For instance, I can say objective 1 is to determine the height, the average height of male residents in SU teaching hospital. It's height. Everybody knows how to measure it. Use your meter rule or whatever. That is, by the time I finish, I divide it by the number of people, I get the average height. It's specific. It's not, I want to know how, I want to see the physique of men. There's nothing called physique of the male or whatever. It's height. Now, I said, it must be measurable. That thing you want to measure, you want to determine, there must be a yardstick to measure it, so that some other person in another place can also do it. For instance, if I want to determine the height is measurable, and the parameter is meter or cm or inch or miles, whatever you want to use, you make it known, so that another person doing it somewhere else can use the same thing and measure. And it must be achievable. You don't say, I want to measure the temperature of the sun. Yes, temperature is measured in thermometer, and it is measured in degrees Celsius or Fahrenheit. But is it achievable for you to measure the temperature of the sun from here? It's not achievable. So things you must do, you must put as your objective, are things that within the context of what you're doing and the study, they are achievable. And then they must be reproducible. How do we mean by reproducible? It means that if somebody is doing this work in SU Teaching Hospital, Parkland, that if another person is in Federal Medical Center or doing the same work, using the same format, he can reproduce what you have produced. So it is reproducible. And what makes it reproducible is by your method. The method must describe what is to be done and how it should be done. Finally, it must be time-bound, especially for dissertation. Dissertation is not for life. Most of the time, it is within 6 months to 1 year. So you must also convince your examiner or at this stage that all these things you have set out to achieve must be achieved within the time limit for that exam, for that program. You cannot start a research that will end in 4 years or 5 years for part 2 dissertation. It doesn't make sense. So you must make sure that what you intend to do, that your objectives are specific, they are measurable, they are achievable within the time and the environment you are, they are reproducible if they want to try it elsewhere, and within that time they gave you or you have, you'll be able to achieve it. Now, a minimum of 12, 2 and maximum of 6 objectives are usually recommended. Now, but for me, I would prefer just 3 or 4 objectives. 2 may be too small, but that doesn't mean it's not good. 6 may be too high, but the higher your objective, the more cumbersome your work is. And there's this temptation that researchers or scholars have. The temptation is to answer all the questions in the world. So your objective will be everywhere. The more you put your objective, the more confusing and cumbersome the work will be. So it's better you study one small portion of the problem at a time. So if you have 2, 3, 4 objectives, 5, 6 if you want, fine. But I don't encourage objective up to 6. However, the higher the objective, the more publications that may come out of it. If one has too many objectives, it will become cumbersome. If you have too few objectives, it will not look like a dissertation. No one study can answer all the questions in one swoop. So take it once at a time, and others can also research on what you are researching and answer the other problems you cannot. So don't make your objective so much. If it becomes so much, it will not, the read may not be sweet. However, a dissertation may generate more than one journal article. And it's for this purpose that if you have if you have many objectives, like you have up to 4 objectives, you can generate 2 journal articles from it. Each of the 2 objectives may be 1 journal, 1 article, another 2, 1 article, as the case may be, or 3 objectives, 1 article, another 3, another article. So it depends. But for the purposes of your exam, don't make your objective too many. You may run into trouble. Both in your analysis and discussion, it will be too cumbersome, and the read may not be sweet. Now, research questions and hypotheses. A research question is asked to answer the problem or puzzle that the study intends to solve. Now, this research question will also reflect your aim, reflect your title. Just like the aim, it should reflect the title. If you look at your title, you look at your aim, you look at your research question, they should have a lot of similarity. They should look alike. They should be brothers. They should be, I don't know, there should be triplets in that short identical triplet. They should look alike. If they differ, then you are walking into the world of nowhere. It should not be answered by simple yes or no. No answers. Please pay attention here. When you're writing your dissertation and you want to ask a research question, if after that question somebody can just say yes and it answers it, or no, it answers it, then it's not a good research question. For instance, if I say, is there any difference between a girl and a boy? The answer can be yes or no, so it's not a good research question. But if I say, what is the difference between a girl and a boy? I cannot say yes to that question. I cannot say no. So to answer that question, you now go into work, and that is the research you are doing. So a research question should not be answered by yes or no. When I did my first writing, I said, is there any difference between the amount of blood loss or something? I can't remember how it was put then. And it was not accepted because the answer was yes or no. And you cannot say yes or no because the work is ongoing. The same question can be rephrased thus, like what I said here. Is there any difference in the amount of blood loss using method A or B? Somebody can just stand up and say, yes, there is. It's not a good research question. But if you can rephrase the same question and say, what is the difference in the amount of blood loss using method A or B? You cannot stand up and say yes or say no. So to answer that question, you go into work. Some authors will ask one question for each of the objectives, which is called a sub-question, so to say, while others will ask only one question after the aim or main objective. It depends on the college and the choice. If it's not a matter of the college, if the college doesn't matter, doesn't bother which one you use, it can be your choice. Even when you want to do a publication, it's your choice. Whether you want to use one question, which is patterned after the aim, or you have One question after the M, and then other questions that are for each specific objective that you have set out to achieve. Depends on the college and it depends on your pattern of writing. As you keep writing, you may choose what you want. And if you are writing a proposal for grant or whatever for people, you follow what they want. In the same vein, a research hypothesis is an assertion or a statement trying to resolve the puzzle raised in the study. Just like when we were learning science in secondary school, they say you have theory or hypothesis. After observation, it's the same thing we are doing. You have observed a problem. Now you postulate a theory or hypothesis. Now, in this case, that hypothesis can be one hypothesis, which is also after the M, or you have sub-hypothesis, which is a pattern after each objective. So in the same vein, a research hypothesis is an assertion or a statement trying to resolve the puzzle raised in the study. There may also be sub-hypotheses for each research question. It can either be in form of a null hypothesis or alternate hypothesis. What is a null hypothesis? A null hypothesis is just a hypothesis that's saying that what you set out to do or what you think is there is not it. While the alternate hypothesis is saying what you set out to do or what you are thinking is it. And the answer will only come, the solution will come after the result. So in null hypothesis, you can say there is no difference in the amount of blood loss following above knee amputation using method A or method B. There is no difference. That is your hypothesis. But your result will affirm or otherwise. Now, the alternative hypothesis will now read, there is a difference in amount of blood loss following above knee amputation using method A or method B. It is also your result that will say this assertion is correct or not. How many minutes do I have more?
You still have more time, sir, Chief.
Okay.
30 minutes.
All right. The next chapter is the material and method. Some people will call it methodology. It doesn't matter. But yeah, it's obvious what I'm trying to look. You must, those materials you will use for that study must be there. As we are going to use meter rule, you also have to specify those materials. Then the method, how you are going to use them. And one thing we should also do is when you are listing, when you talk about the materials, please be specific. Take say, for instance, if you want to cook a good stew and you think that onga crayfish is a spice. I'm not a woman. It's a good spice. But inside the onga, we have onga crayfish, onga stockfish, onga whatever. So you must be specific in the matter so that if someone wants to cook that same thing and get the same taste, he will use the same type of onga. Don't just say you can use spices. Spices is not anything. So in your materials, please be specific for purposes of reproducibility. Now, in these materials and method, you have to talk about what this type of study you are doing. You can say this study is going to be a cross-sectional study if it's still at the level of proposal. But if it's at the level of dissertation, full dissertation, you say this study was a cross-sectional study. So you have mentioned the type of study or the type of research you intend to do or you have done. Now, you have to, under this place, you have to also determine the sample size, the population you want to study, and the sample size. For me, as a gynecologist, I may be studying about pregnant women. I would say pregnant women in Esut, or pregnant women in Enugu, or pregnant women in Southeast, or pregnant women in Nigeria, depending on how big the research is. So that's the population. Then out of these pregnant women, what's the number that I want to work on, the sample size? You have to determine the sample size, and you have to calculate it using either the study you are doing doesn't have a previous similar study close to you that you can maybe take from their own prevalence or sample size to calculate your own. You do a pilot study. Pilot study is just where you take a small number of similar population in a different area where you're not doing the study and administer the study there, calculate and get a samples and get a prevalence or whatever you are looking for. And from that, you can use it now to calculate your sample size. Another problem here is that sometimes it's difficult to get the correct sample formula. So for anybody who wants to do his dissertation, you must study sample size determination very well. You determine the type of study you are doing. When you determine that type of study, you go for formulas that will give you that sample size. Because this is one place they usually hold you. If your sample size formula is wrong, your problem has just started. But if you have this right formula, you get the right sample size. Remember, I said if you don't have any similar study so close to you that you can use their result to determine your sample size, you do a pilot study and use what you get from that pilot study as your benchmark for sample size determination. Then you have sampling technique. How do you select these persons into the study you want to do? That's sampling technique. For dissertation in West African College of Surgeons, and I think in physicians too, they don't accept retrospective studies or just simple questionnaire studies. Also, those studies are too simple for dissertation. So most times you are going into cohorts or you're going into randomized control trials. If you can too, you can do meta-analysis. So you must describe very accurately and clearly how you intend to sample, the sample techniques you want to use. How do you randomly select these people so that you don't have so much bias? And that's where randomization techniques come. Please, especially if it's a randomized control trial, please describe clearly how you select these patients into group A or group B, as the case may be, so that there's little or no bias. Methods like simple random sampling has a lot of bias in it, because when you are going at the time, you start thinking that it's like I'm getting one particular type of people into one side. Let me now alter it. Or you may start saying, you look at this person, since I'm studying obesity, this one is looking fat, let me put it in group A or group B. So if you use good random sampling technique, you'll be able to avoid or reduce bias. Now, you have to, this material and method, you describe the procedure. That means you are going to describe step by step how you will carry this study, from selecting the patients to extracting the data or you need from the patient, and if there is intervention, how you intervene. That everything should be described step by step, so that whoever is trying to do that study elsewhere replicate the study will follow that pattern and is expected to get the same results if what you did was correct. Now, you have to also describe how you want to analyze, how you intend to analyze the data. So, data collected. That means you also have to have a little knowledge about data analysis. It will be important if you know how to collect data electronically, because these days, if you use your paper questionnaire and collect data and give to an analyst to analyze, he may dump that in there for decades without having the time to go and even key it into the computer. But if it's already electronically collected, it's easier for him to analyze, and we won't have so much waste of time. So your analysis must describe what you intend to get. For instance, you want to get percentages, you want to get percent, whatever, averages and the rest of them. You want to use this method of statistics to confer inferences on what you're doing. So your analysis will be there, and it will help the person who is going to analyze the work for you to know what you want to get, and it helps him to analyze those things. So if you don't have what you analyze and you give it to an data analyst, he may be confused, or he may just give you what is in his mind, which may not reflect your objective, and the work you have done would have been a waste of time. I hope we are moving. Now, statement on informed consent and subjects from subjects or patients should be there. You know, most of the studies you'll be doing are on humans as a doctor. So you must have elaborate informed consent form where you explain the problem, the study you want to do, the purpose, the aim. You also have to explain the benefits, if there is any, to the patient or the society or to anybody. And the complications or side effects of what you want to do. That's the pitfalls. So that the person, when he looks at it, can say, okay, after all this, no problem. I still want to go ahead with you. Because it is ethically wrong for you to introduce somebody into something that will harm him without him knowing. And then when it harms him, you begin to, I don't know what you tell the person. You can even be sued. So you must explain to the intending participants everything that is there to know about the study, both the good, the bad, and the ugly, and allow him to make an informed consent. Most of the time, it's a written consent. So if you don't have a good informed consent form, your study may not save. And of course, if you don't have a good consent form, I don't think any ethical group, ethical whatever will give you ethical clearance. So approval for ethical review committee of the training institution must be gotten. Like in Parkland here, we have our ethical committee. For you to study, do any study here, you must get approval. That means you get your proposal, submit the proposal to the hospital and to the ethical committee. They will subject it to analysis, look at it, look at your consent, look at the methodology, and make sure it's not going to cause harm on the subjects. When they look at it and see that the method has no dehumanizing, so the method should be safe. When they go through and discover that, yes, there is little or no harm to the patient or to the system, they can give you ethical clearance. Then you must also list your inclusion and exclusion criteria. Now, this is another problem. One place that appears very simple but may be complicated. Somebody may say exclusion criteria, people who do not give consent. That is not an exclusion criteria. That is too cheap a thing to do. You should look at the subject you are studying and see things that may alter co-founders, things that may alter the results you get. For instance, if you are studying about diabetes and anybody who is on
Yes, you log out. Chief, we can't hear you. Maybe you have to log in again. Sorry, let me get to him. Seems like network logged him out.
Sorry, I was interrupted. So many things are happening at the same time. And we're back. Where the materials and methods. Okay, so as I said, in exclusion criteria, you are looking at variables that will affect your result, affect what you are measuring, and then make your results invalid. These are the conditions you exclude. You not just say, I exclude anybody who doesn't want. Of course, if somebody doesn't give consent, there's no academic, there's no special training to know that that person will not follow. Then in your inclusion criteria, you also describe the particular set of people in the population that you want to use. And there must be explanation for excluding and explanation for including any set of people. Because that may come as a question. Why do you want to exclude the people that are smoking in the study you want to do? If smoking affects the result you want to get or affect the variable you are measuring, of course, and it's not part of what you're studying, you should exclude them so that you just have what is happening without another interference. So don't just say, I will exclude anybody who didn't give consent. It's so childish. It can happen in primary, in MBBS or BSc or OND projects, not in dissertation. Then statistical method for data analysis. You have to specify what are you using. Are you using SPSS? Are you using Excel? Are you using? There are so many apps that you can use to analyze. Why you are making all these things specific is because you want somebody. If somebody wants to replicate this thing, if he should use exactly what you use to be able to refute your result or affirm it. Because if you are using SPSS and somebody is using Excel to analyze, maybe there could be some variations, but that variation will not be from the method of analysis. So for reproducibility, specify whatever you did so that the other persons who want to try it will do exactly the same thing. And then at this level too, when you are studying and doing analysis, the analysis must be able to make inferences. We are not just at this level, you can't be doing just prevalence of this is this, you go and sit down. You must be able to make inferences, how one variable depends on the other, or how one thing affects the other one. So you use things like chi-square test for categorical variables, and maybe student t-test for um, continuous variables, as the case may be. And these things must be specified in your method and analysis. You have to specify this is if it's ANOVA, you are doing any ANOVA, you should make it known. If you are going to do subset analysis, you should make these things should appear in your analysis plan for analysis, so that the person who is going to do analysis for you will also understand and follow suit. Even though he's going to be a professional, but you are to be the guide. You guide him. Now, finally, we go to the result. Not finally, we go to results. Here, you are writing detailed analysis of result to obtain. What did you obtain? Here, tables are coming, figures may follow, diagrams. What you obtain at the end of the analysis, tables are compulsory. Now, percentages to be expressed to the first decimal place. You don't need to say 39, let's say prevalence is 39.7478. No. Just one decimal place is enough. Now, results should be written in reported speech. Why your literature review is not in reported speech? Results should be in reported speech. Your method in dissertation paper should be in reported speech because you have carried it out. You are reporting what you did. But in proposal, your method should be in future tense, what you intend to do if given the approval. I will. But when you have finished and you are writing your decision, I did should be what you have. So the result should be a reported speech. And if you are here, you are going to have tables, and each table must have a name, a heading. The same thing goes for the figure. You don't just write a table without describing that table. That table must have a title or a heading, subtitle. Must have something to make you know this is the you can say the table A is describes the relationship between age and body weight. So that when somebody is looking at that table, he's looking comparing age and body weight. If it is biodata that you are looking at, the table must also explain. If your table has no name or no description, it is useless and nobody will look at it because nobody did the study with you. You did the study. You are describing what you did. You went to the land of the unknown and you are describing what you saw. It is your description that tells us what we know. We can't go beyond what you describe. Figures you also have titles and descriptions in that text. Now, after you have the results, the next thing is the discussion. This is another academic part of it. What is discussion? Summary of major new findings or new knowledge being generated. Now, when you have a discussion, when I went for my research methodology program, the guy made a statement that really guided me and gave me a head start. He said, when you want to start, first of all, bring out what your findings are. For instance, if I'm discussing my findings about the amount of blood loss, I will say, what is my aim? The aim of this study, my own study, is you bring out your aim again. And from my study, I found that 20 people had, or 200 mils of blood was lost after amputation, above knee amputation. That is my finding. Now, in discussion, now I'll now go to what others have done. You will now go to, okay, however, this my finding is the same with what Okafor found in Sokoto, where he described what Okafor found. If they are the same, you don't have to bother yourself trying to speak too much grammar. They are in agreement. But if I say this is different from what Okafor found in Sokoto, this is now where you are expected to describe, try to profile reasons why you have a different result from what Okafor had. And you look at the whole gamut of the study. Look at his methodology. Is it the same with your own? The difference could have been because you use different methods. You look at the type of study. Maybe his own was a retrospective, your own now is a prospective. Maybe the problem now may be because you have different different types of study. His sample size may be small and your own is a big sample size. That could also be the reason. And so you are looking for reasons why two of you have different results, looking at how the study was done. Now, sometimes you may have the same result, but your methods are not exactly the same. Your sample size may not be the same. The people you are working with, that's the population, may not be the same. Now, if you have that type of thing, it's also important to bring it out to show that despite the fact that this study was done among the Caucasians and my own was done among the Black, the result is still the same. Say adding more strength to what you have found. So discussion is not supposed to be too verbose, but it must be targeted. You know where you're going to. You bring out what you find, compare it to what the other people find. If they are the same, you may not have much to discuss. If they're not the same, you try to explain what you think could have caused the differences. That's just what discussion is. It's not a big grammar. But some people will come there, they will be confused. Once you pick your results about a specific objective you have picked, you tell them what you had, you bring what the others, maybe the 4 or 5 other people who have studied it, which you have found in your literature review, what they found, you now explain why the differences or why why the similarities or why the similarities. And you are through with your discussion. But you must discuss all the objectives, the specific objectives that you have listed or you have found, because you have set out objectives, you have achieved them. You must, in discussion, discuss each of them one by one. You don't discuss them, just discuss one thing and say the others are okay. So that's about discussion. It may be started by first quoting your own finding and then comparing it with the previous findings in the literature. Reasons are postulated for variations in findings, while similarities may just be mentioned or emphasized, especially when there are differences in methods or population demographics. So if I did a study among Igbo people of southeastern Nigeria, and somebody did a study among Fulani people of northwestern Nigeria, and we have the same result, it may be of interest to bring out that despite the demographics, the population demographics, the differences in the population, the type of food they eat, the environment they expose, and the one we expose here, the result still is the same. It shows that that finding is a very valid finding. These are some of the things you may have to do in discussion. It's not a long one. Sure, the discussion should be one of the, apart from chapter 3, which is M and objective, I think. Discussion should not also be so much. Sure, it's just something straightforward. But as you are saying, I find this and they found that. The reason could be this. They found this, I find it. The reason could be this. That is academic discussion. You would have finished your discussion. Now, after that discussion, you go to conclusion and recommendation. Now, many times we conclude literature review. People will now be writing what they found in the literature as conclusion. No, conclusion is the conclusion of your finding, the result, conclusion of your result. If after the result I discover that female resident doctors are taller than male resident doctors in a teaching hospital, if that at the end of the result and analysis, I will now say my conclusion. The conclusion is that female resident doctors in a suit are taller than male resident doctors. That is not what is in the literature. That's not your conclusion. Conclusion of your result or conclusion of your finding. And it's from that conclusion and your finding that you now make recommendation. I may now recommend that when employing male residents, because there are so many things that are above, that are on a higher level that require tall people. We can now make height measurements a parameter in recruiting male resident doctors. You are making your recommendation based on your finding, your conclusion based on your finding, not based on literature review or based on popular opinion outside or based on what people think. No, it's your finding that you are concluding, and you make recommendation from it. This is the conclusion of the. This is not the. Okay, sorry. This is what I intend to write. This is not a conclusion of literature review. If you are there, you can that thing can be corrected. It's not. This is the conclusion. It's not the conclusion of literature review or popular opinions. It is a conclusion from the particular study or finding what you have found. Recommendations are statements on useful pieces of advice emanating from the results obtained from the study. Now, if I did a study where I have shown that when that children that had exclusive breastfeeding has better weight gain in the first 6 months. So at the end of the day, I will conclude. I may conclude and say I may recommend that women should be encouraged to observe exclusive breastfeeding for the first 6 months. What was my reason for the recommendation? Because my results have shown that it is good. So you don't make recommendation from maybe what you had on CNN. You make recommendation from what you found in your results. Then referencing. We are running down. This section deals with proper citing of previous findings. When you are writing, whether literature review, introduction, or any part, and you are writing or you're saying what somebody has found, you should give that person credit. So referencing is about giving credit to who owns it. It's a kind of a trademark, kind of a broad trademark, patency. I don't know, something like that. So you don't. If I don't find that if I'm the person that discovered this Zoom, and some other person now is taking the glory, I will not be happy. So in referencing, you properly identify and report that what I'm saying is not my finding, some other person has found it. So it deals with proper citing of previous findings. It helps to reduce plagiarism. If you don't reference what somebody has found and you say that thing, it means you are committing an offense known as plagiarism. You are stealing the person's intellectual property. There are different methods of citing. The common ones are Vancouver, APA, MLA, Chicago, and the rest of them. In West African College of Surgeons, the preferred citing is Vancouver. I don't know about College of Physicians. And in this Vancouver, what is there is that when you make a statement about somebody or you are saying what somebody has found, after your full stop or after your question mark or whatever that is, after your punctuation mark, whatever punctuation mark you will write a number. I don't know, and the number must be 1, 2, 3, 4 in that order. That number could either be a superscript. Superscript comes after the punctuation mark. If it is ordinary number in brackets, it will be before the punctuation mark, maybe before your full stop. Now, when you have written that number, you will go to the section called references and write, if it's number 4, you write number 4. That's where you now write the names of the authors, the study, the name of the work, where it was, when it was published, the page, you will find it in the journal, and or even the DOI, digital object identifier, and the rest of them. So that when I see 4, if I want to know what study or what journal it is, I will go to the references and go to number 4, and then know what paper you are quoting. That's Vancouver. And that's the one I think most of the colleges are using. So there's no need wasting our time. But you can read about the other ones, which is also good. So that when you are reading a journal that is not Vancouver, you know what they are doing. Most institutions prefer Vancouver method of referencing. Referencing may be electronic or manual. Now, if you are reading some journal, you see that there are journals you see the superscript is colored. And once you tap that superscript, once you click there, you see the journal come out. That is electronic. And then some, you tap it, nothing will happen until you go manually to the place you have the manual, you have the references and see them. So can be electronic or manual. Now, then the way you also do the references for electronic and manual differ. If it is If you're doing electronic referencing, maybe using Mendeley, that means you have to download all the articles you will use and store them. So that once you put that article, your computer automatically gives you the name and there's gives the lists the article, the reference, the journal on the reference section. And if for any reason you are changing, maybe you are adding another article in between, it will automatically correct itself, both at the point of on the body of the article and at the reference section. So that way you will not make mistakes of your article is reading number 6, but when they go to the reference, that number 6, what you had in mind is at number 8 or number 7 or number 5. Because if you are doing manual, that means when you change, you go back to references, and begin to change it. It is prone to mistake, but that's the easiest one people learn how to do. When I wrote my own, I also wrote with manual. I did manual referencing, and I'm still learning Mendeley very well. I'm not proficient in it, but if you do, when you learn it, or for those who know it, is a wonderful thing. You don't bother yourself so much about. Once you want to change your ad, remove. When you want to remove a reference, you remove it, and it's automatically removed in every place. You want to add a reference article. Once you add, it will add by itself, and you will not have any reason placing different numbers against the wrong journal. It allows you to store, that's the Mendeley, allows you to store, organize, and cite sources effectively. Plagiarism, we are rounding off. This is a serious academic offense. I have to shout it. It's an academic offense in the academic world. If you are found guilty of plagiarism, some people have been stripped of their professorship, some have been stripped of their award, some have been shot. It's a shameful thing. It's like being caught in armed robbery in the academic world, that you are guilty of plagiarism. This is a serious offense. Please don't be found there. This thing is easier to catch people now because of internet. Almost all articles, before now, we used to have local journal and international journal, where local journals are in paper. They carry them around. A department can have a journal. Even a family can have a journal. Nobody reads it. It's just them. They will now use it to get what they want. But today, any journal that is not online is not taken serious. So now that every journal is online, whatever you quote can easily be, or whatever you wrote can easily be checked. So please avoid this offense, avoid this embarrassment. It involves passing off someone else's work as your own. It is property theft, and nobody should, please, nobody should be found there. When you send your dissertation or your proposal for approval, they will subject it to plagiarism check. And if they check and found a significant degree of plagiarism, if it's a proposal, they will reject it, not they may. If it's a dissertation, that thing may cost you your exam, voting. And once one college found you guilty of plagiarism, like if West African College of Physicians found you guilty of plagiarism, they will write to West African College of Surgeons. They will write National Postgraduate. They will write all their sister bodies. And you can, in short, your case, you may be suspended for years, or you may be banned from attempting that exam for life. So please, let us avoid plagiarism. Plagiarism can be of different types. You have direct plagiarism. That simply means you copy somebody's thing, paste them like that, and you did not reference it. Like somebody has found that good people die early. Maybe somebody found it in 2003 in a journal, and I now say, I found out that good people die early when I have done no work. And I didn't say according to Mr. ABC in 2020. That is copying and pasting. The type we do when we were doing GCA, and where people just shift to Pack, let me copy from you. They'll be copying and pasting. So that's direct plagiarism. You can have indirect plagiarism where you paraphrase somebody's work and put it as your own, but you did not cite the person. That is also dangerous. Why paraphrasing works is a good thing. It also tests your skill of writing. But when you paraphrase, know that the finding is still the person's own. So you must also cite the person whose work you are paraphrasing. Now you have mosaic. Mosaic is like a mixture, combination, where you combine your own original work with another person's work and have a what look like a new one without giving credit to that other person. It is still a kind of plagiarism. And you can have accidental plagiarism when people just, he didn't even intentionally want to do it, but because he's a poor researcher, he hasn't done his work very well, he unintentionally find himself using another person's idea or work. And then when you now look at it, he may be saying, I don't know, he may be innocently wrong or innocently found guilty. So these are some of the types of plagiarism that you must avoid them. This offense has serious consequences. I've explained that it can even deprive you of the exam entirely. It can dethrone you from your high level. It can remove your achievements. It can mess you up in the academic world. You know the funny thing, if they find one of your papers guilty of plagiarism, even the ones you did very well in the past, everybody will now cast a doubt on your work. They will say, this man, we don't trust him. It's like he just copy things and paste. So no research should ever be found guilty. No researcher should ever be found guilty of this offense. How to avoid plagiarism? One, you cite people properly. Once you are writing what somebody has done, please cite the person properly. Let the glory, kudos, go to the person. Don't put it on yourself. Paraphrasing and citing. To avoid just copying and pasting, even if you will cite, see a way you can change the English but continue saying the same thing, but give the glory or the credit to the person who has the final finding. Like somebody said, if somebody said 20 out of every 100 people are found to be tall in Enugu and is found by Mr. A, I can now say 20% of male in Enugu are tall, but I'll still give it to A, but he said 20 out of every 100 people. I say 20%. They are the same thing. I paraphrased it, but it's the same information. So when you turn it into the plagiarism check, it's the same thing we are saying, but it's not going to, because it's an automatic something. We're not going to see it as plagiarism. More so when there is a reference to it. Now, you can quote people. There are things you can just quote verbatim, what somebody has said. You use parentheses. You know, when you quote somebody, you put it in quotation mark. When you quote, you put in quotation mark. That shows that you are lifting what somebody has done. And you should also give credit to the person who has it. Then try as much as possible to be original in your work, originality. Not this idea of some people will go to, a resident in Enugu will go to Meduguri, collect one research dissertation work that was done last 2 years in West African College, National Postgraduate Medical College, and use it in Enugu to go to West African College of Surgeons of Physicians and Panebit, where he sees University of Meduguri, he will put UNTH or he put a suit. Well, so before you know it, you may never know that they didn't even change everything. Even if they don't use a plagiarism check, they may see a work in Enugu suddenly, see where they say, and here in Udut, they will now sit down. No, this one is like a copy, they didn't see all of them. So be original in your work. Do proper citation, paraphrase and cite, put quotation mark and cite, and be original. This way you reduce the risk and the temptation of plagiarism. Tools to retain plagiarism, which you can also download into your computer. And when you have finished your work, you subject it to plagiarism check and see whether you pass. Because that is the same thing most of the colleges will use to check whether you pass it or not. We have I think the most popular, or the one I know that is most commonly available, is Turnitin. Then we have the Grammarly, we have Plate Scan, and the rest of them, whichever one you want to use. If you can find the one most that is used in your college, it will be better for you to use that one to check yourself. The maximum percentage of plagiarism accepted for dissertation is about 5 to 15%. Some will even say not more than 5%, but most colleges will stop at 5, or institutions 5 to 15%, because there's no way everything you write will be, there's nobody who have written it. So if you have a minimum of a maximum of 15% plagiarism in your work, it will be accepted as the original. You can turn in your work for plagiarism using any of the tools above and assess yourself. Please, this assess is not ACC, it's typo, it's ASS. Assess yourself whether you are good to go or not. In conclusion, dissertation is a scholarly work that intends to enrich the existing body of knowledge. It's not just for fun. When you finish, something new must have been added to the existing body of knowledge. It involves critical thinking and accurate designing. You have to think critically and design accurately and carry it out the way you have designed it to get the result. Every resident doctor and consultant is an academician and should be proficient in both writing and supervision of dissertation. Because once you pass your exam, you become a supervisor. If you pass your part 2 and you become a consultant or a lecturer, you have automatically turned a supervisor. And remember, there is no classroom where they are teaching these things. You learn on the job. So we are all potential supervisors. Therefore, let's pay attention, especially when you are doing the work, so that by the time you pass through it, it will have also passed through you and things will not remain the same. Thank you for your attention and for the privilege.
Thank you very much, Chief, for this wonderful lecture, and was quite exciting. And I also believe that the participants here, they are all happy. They are all happy about this presentation. So if you have any question, please, you can kindly raise your hand. The next 5 minutes, you can raise your hand or you can type your questions on the chat so that Chief can address them. You have any question? I know that Chief have done a very wonderful job here. In fact, everything he explained everything. In fact, he made a complex topic look simple. So if you have any question, please. Can ask. But what the biggest innovation and innovation that we're still doing is what's known as immunotherapy. And immunotherapy is essentially the use of one's immune system to stimulate.
Okay, I don't think question since nobody has asked you now. We want to use this opportunity to thank our speaker, Dr. Onyekpa Ifeanyi, for the wonderful delivery of this webinar. Thank you so much, Chief. We appreciate you for making
You're
out the
welcome.
time. Yes,
The
thank
pleasure
you
is
so much.
mine.
I think the lecture was quite clear because it's a rundown on the components of a dissertation. So it was clear. This cleared us on some aspects. So thank you so much. It was a very lucid one. God bless you. On behalf of the president, I don't know if he's here, so he can give his okay, the president is here. He can give his vote of thanks. Dr. Nnaedogo, please.
Yeah, Dr. Gloria, thank you very much. Good evening, my chief, Dr. Onyekpa Ifeanyi.
Good evening.
Good evening, the coordinators of our research webinar. And good evening, everyone. I just want to thank my chief for making a time to be with us and then for that very wonderful delivery. I believe that the program so far has been quite impacting. And I want to thank him also for joining the other lecturers and then our other researchers to empower us with this knowledge. So, Chief, I thank you very much. God bless you. And my work is still pending, Chief. Maybe after this one, we'll go back to it. So thank you, everyone, and thank you, the coordinators. You guys have been so wonderful. We'll still have 1 more week to go, right? So, Gloria.
Okay,
Yes.
3
Okay.
more.
All right. Sorry?
I said 3 more.
Okay, 3 more. All right.
3 more.
So we'll meet again next Monday. And for those asking about the recording, when it's made available, it will be shared. So thank you very much, and let's enjoy our evening.
All right. Thank you so much.
Thank you very
Thank you,
much
everyone.
for that. Thank you.
Thank you. Bye.
It's expensive because it requires a very specific kind of lab mouse. So now she decided she's going to just get away from it and start working in some other fields.
But Dr. Gochu, please can end the meeting.
Okay.
Making great stride